On Taiwan, Taiwan has been trying to secure an invitation to the World Health Assembly, and 13 member states made a proposal for it to join. Was the US one of the 13, and what is the US doing to try to get Taiwan access to the WHO beyond public statements?
Well, we strongly advocate for the WHO to invite Taiwan to participate as an observer and lend its expertise to the solution-seeking discussions at the 75th World Health Assembly scheduled for this month. We believe that inviting Taiwan to participate as an observer would exemplify the WHO's commitment, stated commitment to an inclusive approach to international health cooperation and quote-unquote health for all. Taiwan, in that regard, is a highly capable, engaged, responsible member of the global health community with unique expertise and approaches that can benefit the world. We've made this point before that Taiwan has much to share with the world in different realms, including in the realm of public health. And of course, Taiwan's absence from the WHO in recent years is something that we have sought to rectify. The WHO broke years of precedent at the 70th World Health Assembly in 2017 when it failed to invite a Taiwanese delegation to observe. Taiwan's inclusion, unfortunately, has continued every year since 2017. As we continue to battle a pandemic, as we continue to confront other public health threats, Taiwan's isolation from the world's preeminent global health forum, it's unwarranted. It represents itself a serious health concern. We believe that its significant public health expertise, its technical and technological capabilities, its democratic governance, its resilience in the face of COVID-19, and its robust economy offer considerable resources to inform the WHA's deliberations, and we believe there is no reasonable justification to exclude its participation.
Was the US one of the 13 that made the proposal?
We have supported Taiwan's participation as an observer at the World Health Assembly.
My question is about the Secretary's policy speech on PRC. Could you help us understand the rough outline of it? And I also wonder when he will deliver it.
I am not in a position today to offer a rough outline, but I can assure you that the Secretary intends to deliver these remarks at the first possible opportunity. As you know, he was set to deliver it the other week, but of course his COVID diagnosis disrupted those plans. But we'll have more details on that shortly.
Thank you, Ned. About the corona crisis in North Korea, it was reported that 3 North Korean cargo planes were carrying corona treatment medicine from China yesterday. You know that North Korea likes Chinese vaccines. What if North Korea requested assistance through COVAX? Will the United States agree with North Korea's, North Korea wants an assistance through COVAX?
Your question is, what has North Korea requested?
Yeah.
Well, unfortunately, to date, the DPRK has refused all vaccine donations from COVAX. I say it is unfortunate because we are deeply concerned about the apparent COVID outbreak within the DPRK, how it might affect the North Korean people, and the United States continues to support the provision of vaccines to the DPRK. We would like to see humanitarian, including medical relief, provided to the people of the DPRK. To that end, we strongly support and encourage the efforts of U.S. and international aid and health organizations in seeking to prevent and, as necessary, to contain the outbreak, the spread of COVID-19 in the DPRK, and to provide other forms of humanitarian assistance to the North Korean people. It is COVAX that determines allocations for the Pfizer vaccines. We have donated. Those are the brunt of the vaccines that we have donated. Should COVAX allocate doses to the DPRK, we would be supportive of that, as we would to any member of the grouping and to the African Union as well. As I said before, however, it is the DPRK that has consistently refused all vaccine donations. We don't currently have bilateral plans to share vaccines with the DPRK, but we continue to support, as I said before, those international efforts aimed at the provision of critical humanitarian aid to the most vulnerable within North Korea. There's another great irony, or perhaps it's even a tragedy, in that even as the DPRK continues to refuse the donation of apparently much needed COVID vaccines, they continue to invest untold sums in ballistic missile and nuclear weapons programs that do nothing to alleviate the humanitarian plight of the North Korean people. The DPRK leadership continues to enrich themselves, to take care of their cronies, while the people of the DPRK suffer apparently now with the added burden of COVID.